I am Sangam, and I'm very delighted to be here with you all today. And firstly, I would like to thank National College for inviting me here to share some things about global health and some of the contemporary and emerging health issues. So my academic background is I completed my master's in global health from New York University, and I'm currently working at Rural Reconstruction Nepal as a public health officer in Research and Strategic Partnership Department. So my presentation will be mostly about it's not a paper presentation, but just a general presentation about global health. Okay, so in this we will explore a little bit about contemporary and emerging health issues around the world. So in this presentation, I will cover talking about what global health is, why it matters, and evolution of the global health and some of the efforts in global health. And then we'll talk about a little bit about the disease burden around the world and what are some global health disparities and what drives our health and what would be the role of academia in improving the health of people. So firstly, starting with what global health is. According to Institute of Medicine, USA, global health is defined as health problems, issues and concerns that transcend national boundaries and may best be addressed by cooperative actions. Global health, it works to improve health and achieve equity in health for all people worldwide. It emphasizes on transnational health issues, determinants, and solutions. It involves many disciplines within and beyond health science and promotes interdisciplinary collaboration. It is a synthesis of population-based prevention with individual-level clinical care. So starting with, next we have why global health matters, why it is important. So with globalization increasing trade, tourism, and travel, our world has become interconnected more than ever. And despite the political and geographical boundaries, we have come to know that health has no boundaries. Disease outbreak in one part of the world can impact global security. This can eventually disrupt economy and social stability. And as a global citizen, it is our ethics and responsibility to protect and promote the health of people around the world. For instance, we can take the recent example of COVID-19 pandemic that had shown that disease do not have the boundaries. And we have also seen how these health challenges have impact beyond health and across social and economic disruptions and draining our resources and deepening the existing poverties and inequities. So talking about the history of global health, we say global health, but global health has transitioned from a narrow focus on tropical medicine that began in 19th century, primarily aimed at controlling infectious disease in colonial territories. Later, it expanded into the broader concept of international health, focusing on the health problems in the developing world, mostly focusing on maternal and child health, nutrition, family planning, and population control. It was mostly characterized by donor-led interventions rather than the priorities of those countries. So after World War II and with the rise of multilateralism, in 1944, UN established WHO as the specialized agency responsible for monitoring and improving world health. And WHO now works by setting international standards for health, collects and analyzes data from around the world, and monitors concerning new and old diseases and helps to coordinate emergency responses and research between the countries. The concept of global health was introduced in the early 21st century with a focus on promoting health and equity around the world. It was driven by globalization and increasing disease epidemics around the world, when they said that we need to prioritize the issues of those countries, not just our priorities. So now, after the global health, we have also come across another beautiful concept that is planetary health. We already know through the global health that health of the people is interconnected throughout the world. But now with the planetary health, we can say that it's not just the health of the people, but also with the environment. Our health is connected with the environment. So here are some of the efforts in the global health. With proper collaboration in the history of global health, we were successfully able to eliminate smallpox And there had been another exemplary initiative taken in the realm of global health, that would be polio eradication initiatives, HIV/AIDS initiative, and recent COVID-19 response. And we all know that despite several efforts, we know that our world and our health did not start in a clean state. There have been pre-existing inequities, social, economic, and so thus we have health challenges around the world despite the effort to improve the health. And to measure the health loss over time, Institute for Health Metrics and Evaluation, IHME, conducts study to improve disease burden across the world. So this disease burden is a comprehensive assessment that quantifies health loss across place and over time to improve health system and eliminate disparities in health. So this global disease burden is measured by disability-adjusted life years, which is the summation of years of life lost due to premature mortality and years of healthy life lost due to disability. So global disease burden is influenced by various factors, including demographic change, epidemiological transition, environmental change, economic development, social determinants, health interventions, urbanizations. And in the first figure, we can see that it represents the global demographic transition starting from 1970s, 2015, and 2060. In that figure, we can see that how our demographic have changed over the time with increasing life expectancy in terms of gender as well. And in the second figure, we can see the global epidemiological transition basically here throughout 1970s, 2015, and 2030. So in the first pie chart, we can see that 53% of the deaths were attributed to communicable diseases in 1970s, where 40% of them were attributed to NCDs and 7% to injuries. So from 1970s to when we come to 2015, we see that a substantive change, I would say, because where 66% of the deaths are now attributed to non-communicable diseases, and 25% to communicable diseases, and 8% to injuries. And in 2030, it is estimated that, again, 74% of the deaths are going to be attributed towards NCDs, 70% to communicable diseases, and 9% to injuries. So over here also we can see the changes in epidemiological transition of 1990s versus 2021, where in 1990s, most of the leading causes of death around the world were due to the communicable diseases, whereas in 2021, NCDs became the leading causes of death around the world. And also in 2050, it is estimated that NCDs are going to be the leading causes of death around the world. So why now we will talk about some of the health disparities around the world and what are driving it. So health disparities are the difference between populations in the ability to achieve positive health outcomes, and multiple factors kind of contributes to the health disparities, starting from the race, ethnicity, sex, sexual identity, age, disability, socioeconomic status, geographic location. All these things contribute to individuals' ability to achieve good health outcomes. So moreover, sometimes these disparities also have multiple inequities. For example, a woman from rural marginalized communities face greater health disparities and bad health outcomes than a man in the same community. So that would be another concept of the intersectionality. In that way, the life expectancy will be impacted and our healthcare access will determine our health outcomes as well. And also in the global, when we talk about the global scenario, most of the deaths and burden of diseases in the lower and middle income countries are preventable. So they can be, with the proper efforts and initiative, those deaths can be controlled. However, when we look at in the most high income countries, most of the deaths are due to the non-communicable diseases. So this also shows that high income countries have already taken the steps to prevent most of the disease that can be prevented. So next with what drives our health. So Dahlgren and Whitehead developed the social determinants of health model in 1991 that helps to escape the commonly held notion that health is just determined by the formal health services and encourage people to consider what can be done in the different sector to influence population health. For instance, again, individuals in low-income neighborhoods may face barriers such as poor housing conditions, limited access to nutritious food, and inadequate healthcare services, of all which can contribute to poor health outcomes among people. So in this first framework developed by Dahlgren and Whitehead, we can see that health is determined by individual lifestyle factors, social and community networks, and general socioeconomic and cultural environmental condition from micro to meso level. And also how access to education, economic stability, social community context, neighborhood and built environment, and healthcare access and quality can determine one's health. So for here now, we have known that there are a lot of health disparities around the world. Nevertheless, so these are some of the things that I've listed. It can be different among different people. You can kind of view the challenges differently according to priorities. But here, some of the global health challenges that seems to be around in today's world are climate change and health, non-communicable diseases, especially cardiovascular diseases and diabetes, infectious disease and global health security, mental health and substance abuse, lower respiratory infections, antimicrobial resistance, aging population and dementia, healthcare human resources challenges, road injuries, health inequities and social determinants, conflict and humanitarian crisis around. So what can be the role of academia in today's world to improve the global health? We all know that academia also plays a crucial role in global health through research, education and policy influence, fostering innovation, training professional, and shaping health policies to address global health challenges. By integrating interdisciplinary learning, connecting and teaching learning with real-world problems, and with the Partnership for Global Health Innovation, joint research initiative, and training the future leaders in system thinking, equity, and implementation science, we can contribute in a global health area. And we can act locally to produce global impact. So another thing, one of the things that I've learned during in my university was decolonization, the concept of decolonizing the global health. Decolonization of global health is an intentional effort that focuses on deconstructing and rebuilding the global health system. It is all about shifting the power that lies in the global north to the global south, where we can have a leadership within the countries, communities to solve our own problem, where we can build equal partnership with other countries and institutions to advocate for our health of our people. So some of the recommendations would be improving international emergency response coordination preparedness, build public capacity in low and middle income countries, optimizing system, sectors and partnership for impact, health system strengthening, multi-sectoral collaboration to address social, environmental and economic determinants, promoting sustainable financing and social protection in health, improving digital health infrastructure, and engaging empowered communities, civil society, academia, and fostering research and innovation for impact. So with robust advancement of technology, innovation has interconnected not just our problems, also the opportunities around the world. So with the effective collaboration and with linking diverse stakeholder resources and expertise, we can produce better global health outcomes. Thank you.
Thank you.